So Rakhi gave me this topic. I like that, at least some thought process. So I'll be speaking for planning for 2030. So I thought my term is till 2025, but unless we plan from now, we can think of. I like to have input, any suggestion from my talk. So the goal is to definitely collection and utilization, then the quality control and accreditation system, and graft registry, and sending tissue across the border. So as we all know, it's a long back, but 1 lakh cornea transplant is required. For that, 50% utilization. So we need 2 lakhs. Like Arvind So's collection has doubled and our utilization is tripled, but still we are much behind the targeted number. You can see the highest till now is 57,000 collection, and all of us know 2020-21 has gone deep. So for this target, again the calculation was we can do in 50 eye banks 4,000 cornea per year. But how many eye bank do 4,000? But in pen and paper we have 735 eye banks, and if you see 4,000, only one eye bank is 4,000. So this is the latest 2000, not 2022-23, 2021-22, 2022-23 is yet to come. So except one eye bank, we're not, and even if you see that more than 1,000 also, hardly few eye banks are more than 1,000. So this is EBI data. I don't know whether some people send or don't send. So the planning is to have more eye collection center than more eye banks, because the eye bank is just a namesake, but eye collection center is more required than eye bank. And eye banking activity in different parts of the country, because if you see northeast, hardly any eye bank, and to do that we need manpower also. Just opening will not enough. So training center, Rakhi will touch on training center in different zones of the country. And although I'll say that voluntary things should increase, but we should focus more on HCRP. If you see different zone utilization, the east zone is the list, and this is south zone is the most in 2000. If you see the 2010, 2015, 2020, in 2020 it has increased. South zone has increased significantly. Coming to utilization, there should be more emphasis on utilization rather than collection. Although many eye bank has moved that from utilization is the target, not the collection is the target, and more lamellar surgery, so that at least the utilization rate will improve for the DALC, and training of corneal surgeon. Again, some places is abundant surgeons, some places nobody is there, and well-designed corneal distribution system so that we don't waste a single cornea which is usable. And again, more transplantation center. For that, EBI or government should take more interest for getting, because like Dr. Bhatia told, it takes more than 1 year. Same situation in Odisha also is not better. And quality control accreditation, we should start for all eye bank, like the hospital NABS. Similarly, accreditation should be mandatory to maintain the quality. For that, again, what is the planning? Just we can't start overnight. We need to train the assessor. We need a lot of assessor if we want to cover throughout India. And who will be the accreditation organization, that we need to decide. So graft registry is available in many countries, though we do, again, EBI also need to get recipient information so that to build up graft registry. To plan for the graft registry, we need to design a database, we need to train people, and proper documentation by corneal surgeon. Because we need to know not only the uses, again the follow-up, how the graft was, how many graft failed, how many lamellar graft failed, how many penetrating graft failed. So we all know that we have a long waiting list as for the first or second slide where I showed is required. But we did a survey during lockdown which says hardly, like before COVID, less than 70 days. Hardly any surgeon is waiting for, any surgeon or eye bank is waiting more than 90 days. So the waiting list is almost, I'll say, nil in many parts of the world. So I don't know whether there is a waiting list or not. Anybody who asks, they say no, we don't have a waiting list. So that is the controversial point comes sending tissue across the border. If we don't have a waiting list, why are you waiting for the sending tissue across the borders? It may be the state, it may be the across India. It may not be now, but at least we should plan from now that we can send the tissue across the border. So bottom line is we should not waste any single tissue. Either we have a long-term utilization, a long-term safe life, either vision graft or anything, or we should plan to send the tissue. For that, we need to have a data whether is that still 1 lakh, 2 lakh existing, although we have not reached the 2 lakh or 1 lakh utilization. But how come the surgeons are saying they don't have a waiting list? So for that, we need again the epidemiological data to know about the demand supply gap, and we need to change the legislation if we want to send across the state. Many states are allowed, but luckily Maharashtra is now they're allowed to send. So paradigm shift in iBanking is already happened. More emphasis on utilization. Most of the people are using Cornisol or Optisol per collection, while many iBanks are still in MK. We collect in MK. We change to Cornisol in case we want to send to outside. And the iBank has to be self-sustainable. We have to start charging processing fee charity model to self-sustainable model. Otherwise 735 iBanks and practically 20 iBanks work. And preparation of pre-cut tissues, again like Sunita mentioned, many have started, and Demacrol we started distributing. So way forward, it's iBanking activity in all states, and we need to develop donation counselor as well as training. I'll say technician come counselor is the best, and training of general ophthalmologist for treating patient with corneal transplant. Otherwise, we lost many grafts. A more trained corneal surgeon, more lamellar surgery. We need to have epidemiological information about corneal blindness. We have to plan for corneal graft registry, mandatory accreditation, and we need to involve more in advocacy and policy making. Thank you.
Thank you, Dr. Sujata. It's extremely the situation is so volatile with our states, and the way that every state looks at iBanking in general. Many of them with a very jaundiced eye. Somehow they feel that we are evil creatures out to steal corneas, make money by hook or by crook. I mean, that's the attitude. In our own state, I know that we have had 3 writ petitions filed just to get what was our due. One was just to get the money which the government is supposed to give for eye donation, which we had not got for 6 years. We filed a writ and we got that. Then to allow corneas to go out of Maharashtra, we filed a writ and we got that done. But every time you can't, it's an expensive process to file writs, and it's not the core area of iBanking. So I think every iBank should have a lawyer in their team of board, in their board of directors or whatever, so that they can guide them at least pro bono. The way, I mean, looking at 2030, I don't think attitudes of the authorities is going to change. So we'll need a lot of lobbying, I feel, from our EBAI at the center. We can't lobby states. But if the center changes its thinking, like we are trying to get delinking of cornea from HOTA, because so many things out in HOTA is not applicable to cornea. We tried that with a lot of influence. We got to meet somebody very high up in the health ministry. And then his personal opinion, which he put down on paper to us, is that I don't see what's wrong with the present system. After pointing out 10, 15 different things which are wrong, he just said, I don't think, and he's put it down on paper. When an IAS officer puts down something on paper, his next 3 years, 3 people who transfer to that post don't want to touch it with a 10-foot pole because somebody's put it down on paper. So these are, I think, some of the challenges that we will face in up to 2030 is sensitizing government authorities, getting the delinking of cornea from HOTA, and getting them to allow free movement first within the country, and then hopefully we becoming surplus and sending out. So especially tissue like vision graft and all has the potential to be a game changer. We can send it to neighboring countries as well and earn some money for the iBanking movement. But let us remain. I think we have to remain positive. If we who are in this room continue to remain positive in spite of odds, only then we will achieve. Because very easy to get defeated by the attitudes of the powers that be. but we just have to keep on pushing a little, 2 steps here, 1 step back, but then move forward. Yeah. Thanks.
Thank you.
Yes, Raki.
So one request to you and Dr. Sujata is that the THOTA registration for the iBank as well as the corneal surgeon is becoming more difficult and difficult. Not because the process are difficult, because the inspectors who come to inspect, they are not aware about anything. So they come as a mindset that because they are the inspectors, they can ask anything, everything. And it's more become that how much you can entertain them at that point of time instead of showing them the documentation and all. So one thing, if like in Telangana, I know that EBI a representative is a part of the team in the inspection team. We in UP, in Rajasthan, and Delhi, we get inspectors who are not even aware about cornea or eye banking. They may be from retina or glaucoma or pediatric ophthalmology. So if we can take it, I know it's a state subject, but at least with National Program for Control of Blindness, if we take it as a representation and more of a repetitive basis, it can help others. And because I know that Karan, while he was filing his TOTA certification, a lot of conversation, whom to contact, which form to fill. So if we can train people as an iBank association, what is the list of document they will be asking for, what are the kind of equipments they needs to be there. So at least a standard training module for the iBankers as well as the cornea surgeons to help them getting the TOTA certificate in a more easier manner. That will definitely help us.
I'll add to that. So 2 centers I was in, sir. So first, one center was applied on Jan 2022. Inspector did not come. Things happened. It's still nothing has happened. Some documentation, some error they have later on put it up. It's still not happened. My center, my personal center, I applied in September, October. I've got the thing, but that was because my inspection happened earlier. In November, they were supposed to scheduled for December, but they came earlier on November. Inspection done in November, all approved, everything done. Then it took 3-4 months for the file to reach there, and for 1 month or more than 2 months, the file was on the IAS officer who was the head's table. Nothing done about it. Calling every day, please do something about it. Sending people across, it was a big challenge. Finally, I got somehow to connect to their office. I spoke to the IS officer, madam, many patients are waiting, please sign. 30 minutes it was signed in this. But why this process? If we are trying to serve patients, something if EBI can do this process, a centralized process, it will really help, rather than going to the state for this.
Yeah.
One common problem which we face is that you have already got the certification for your iBank or for your cornea transplant center. Now you have applied for the renewal, and 3 months have elapsed. Renewal inspection has not occurred, but surgeon knows that whenever the renewal will occur, it will be from the back date. So can surgeon perform surgeries during this period or not?
It's very, very dependent on your state. Our iBank, we had the same issue in Maharashtra. So our iBank wrote to the government that please allow us to give tissue or tell us no, one way or the other, that an iBank or an eye transplant center whose registration has lapsed, but they've already applied for fresh, can we continue giving so we had asked this question, and very cleverly we had put down that in absence of any communication from you, we will deem it as consent from your side to give so we know that the government takes a long time to answer any question. So our iBank continue to give tissue to those people, but at our risk. That we took that. Many iBanks are not willing to take that risk. So if you write to the government saying that we will continue to supply, in case you have any objection to this, please let us know. So if the iBank writes to the government, then even if those fellows take 1 year to reply, you keep supplying. That is what we found worked.
This center was actually served for renewal.
Yeah, it's like hospital, same thing.
So
Hospital, we don't
same thing.
close down. No, when the renewal happens, we don't close down. I think we can either we can write we are continuing in your.
I am Dr. Madharia from Bilaspur, Chhattisgarh. In our small state, what we have made to accelerate the things, the doctor is telling, facing the problem of that inspector is coming and all this thing. We directly talked to our health minister and we requested him in the health department, at least the deputy director who is doctor, who is sensible, he should be the in charge of this such type of sensitive things. So he's agreed. And Dr. Subhas Mishra at our Chhattisgarh, he's the deputy director who is in charge of all these things. So we can directly talk to him. The things are very much accelerated. And it may be the problem in the bigger state, IS person are sitting, so it is really a biggest hurdle.
Yeah.
IS, they are the biggest hurdle. They don't know anything, but they think he's the boss of everything.
Yeah.
This is very unfortunate thing.
Yeah.
Thank you.
Okay. Yes.
So I'm from Bihar, and it's got very limited number of banks, as you know. So one thing that my suggestion was that, as Madam was telling, that many people do not know that how to go about establishing an iBank. So could the EBAI put these, notate it step by step on its websites, because anybody wanting to establish would first of all Google iBank Association of India. We'd like to go, know things from you.
Yeah,
So
we're
if we
revamping
could-
the website. Maybe this is a good idea.
if you can put it on the step by step,
Yeah.
how to establish an iBank, and step by step, who to
All three.
contact
How to
first.
establish an iBank, an EDC, and a transplant center.
And the logistics of it, sir.
Yeah.
Who do you apply to? What a standard format of an application that can be written for this purpose?
I think you've got something already.
It's the website we're planning to change.
I think
Yes,
it'll be done
please.
soon.
A standard, that will become a standard, protocol. So just we take down that document, and you can fill in the name, and then we can apply.
Yeah.
That would be.
You'll
that
still
would be
have to
so
tweak it a little for your local authorities, but
that's all right, sir.
by
At
and large,
least
80% of the work is
it will
already
be
done.
sir.
Yeah.
For us.
Okay.
Thank you, sir.